Yes, the APOLLO trial is a national study that is run by the ECOG-ACRIN group. So this is a national trial. The trial design is relatively simple. This is for patients with resected pancreas cancer with no sign of recurrence who have completed all of their routine neoadjuvant and adjuvant therapy, so chemotherapy, surgery, radiation, if that was included in their care, is all fine, and have no sign of recurrence, and have a known germline or somatic BRCA1, 2, or PALB2 mutation. And patients are then taken and randomized in a 2-to-1 fashion. So 2 patients will get drug for every one who gets placebo, to get Olaparib for 1 year or placebo for 1 year. The goal of the study is to try to reduce recurrence rates in these patients. So progression-free survival is our primary endpoint. And it was based on 2 different studies. One was the POLO trial that showed activity of Olaparib in the metastatic setting in patients with BRCA. And so we're thinking maybe that PARP inhibitors have efficacy in pancreas cancer with BRCA and PALB2 as well. So we've now moved that into the curative intent setting. And the other study that was really instrumental is a very similar design in breast cancer. So there was a study in breast cancer called OLYMPIA, where patients with BRCA mutations who had complete early stage breast cancer, who had completed all their regular therapy, were randomized to get Olaparib for a year or a placebo. And the study was positive. It showed a reduction in recurrence rates and an improvement in survival. And it led to the FDA approval of Olaparib for that particular setting. So essentially, what we're trying to do with APOLLO is trying to have the same type of treatment option for our BRCA and PALB2 related pancreatic cancers in the hopes that we improve their outcomes.